Hey everyone, welcome back. Ready to dive into something that's all about protecting your vision.
Absolutely.
Today we're talking about retinal tears.
Okay.
I'll admit, the name sounds a bit intense, maybe even a little scary.
Yeah,
But with the right knowledge, you can catch it early and most importantly, keep those views crystal clear, right?
that's right. And I think, what's interesting about retinal tears is how a seemingly minor, issue, a tear in this delicate part of your eye can actually have a really significant impact. And it really kind of speaks to the intricate workings of our vision.
Yeah, absolutely. So let's unpack this a little bit. We're talking about the retina, that light-sensitive tissue at the back of the eye.
Exactly. Imagine it kind of like the film, in an old school camera.
Right, okay.
So a retinal tear is literally a rip, a hole in that film. And just like a damaged film kind of messes up your photos, a retinal tear can disrupt how your eye captures images. And that can lead to serious problems, especially if it's left unchecked.
And when we talk about serious problems, we're talking about retinal detachment, right? Which, from what I understand, can lead to vision loss.
Yeah, you got it. So a retinal tear on its own, you might not even notice any vision problems right away, but it dramatically increases the risk of retinal detachment. And retinal detachment is where part of the retina actually pulls away from the back of the eye, kind of like, wallpaper peeling off the wall.
Oh, okay.
And that is a medical emergency.
Got it. So that's what we want to avoid. We want to catch that retinal tear before it gets to the stage of retinal detachment. What are some of the red flags? What should we be watching out for?
So the thing is, these warning signs typically appear very suddenly. It's not like a gradual change. So things like flashes of light,
Okay.
like seeing stars out of nowhere, or a sudden increase in those little floaters that you might see drifting across your vision.
So those floaters, most people have a few, but a sudden increase is something to really pay attention to.
Yeah, exactly. And along with those, also a sudden onset of blurry vision, or, and this is a really important one, if you start noticing what looks like a shadow or a gray curtain, particularly in your peripheral vision.
A curtain. That sounds kind of ominous.
It is. That can be a sign that the retina is actually starting to detach.
Oh, wow.
So any of those symptoms, flashes of light, the floaters increasing, blurry vision, that curtain, those are all signs to get to an eye doctor right away.
Don't wait.
Do not wait. Don't wait to see if it goes away, because with retinal tears, early detection is absolutely key.
Okay, so now I'm curious. What actually causes a retinal tear to happen in the first place?
So the most common cause is when the gel inside your eye, it's called the vitreous, pulls away from the retina. And this is known as posterior vitreous detachment, or PVD.
That sounds a bit complicated. What is PVD?
So it's actually a very normal part of aging for a lot of people. As we get older, that vitreous gel naturally shrinks a bit. Think about like peeling a sticker off of something. Most of the time it comes off cleanly, but sometimes it catches and pulls.
Right.
And in this case, that pull can sometimes cause a tear in the retina.
So it's like that sticker analogy, that pull. Sometimes it can cause a little rip.
Precisely. Now, another thing that can cause retinal tears is an eye injury, like a blow to the eye, but that's less common than PVD.
So let's say someone is experiencing some of those warning signs we talked about, and they head straight to the eye doctor, which is what you said to do.
Absolutely.
How do they even diagnose a retinal tear? How do they see it?
Well, it all starts with a really, really thorough eye exam.
Okay.
And during this exam, the ophthalmologist will use some special eye drops to dilate your pupils.
So that's like opening up the curtains to get a better look.
Exactly.
Yeah.
Exactly. It allows them to see more of the retina.
Okay.
And with your pupils dilated, they can use a specialized lens, kind of like a magnifying glass, to examine the retina in detail.
Oh.
And they'll be looking for any tears or any signs of, potential detachment.
And what if they spot a tear? What happens next? What are the treatment options?
Well, the good news is that we have some really effective treatments for retinal tears.
Okay.
And the even better news is that most of these are outpatient procedures.
Oh. Okay, so nothing too invasive.
Yeah, you can go home that day, typically.
That's good.
The most common treatments that you'll see are laser surgery and freezing, which is also known as cryopexy. And they both aim to do the same thing, which is to seal that tear and prevent any further detachment.
Okay, so lasers and freezing, I've got to ask.
Okay.
How do those work on something as delicate as the eye?
Yeah.
Let's start with the laser treatment.
Sure. So it's a very, very precise procedure. And in laser treatment, also called photocoagulation, the ophthalmologist uses a focused laser beam.
Okay.
And they create tiny burns around the tear.
Wait, burns on the eye? That sounds intense.
I know it sounds dramatic, but it's very, very controlled.
Okay.
And what these tiny burns do is they create scar tissue,
Okay.
and that scar tissue essentially acts like a weld, sealing that tear closed and preventing it from expanding.
So it's like a microscopic welding job, but for your eye?
Exactly.
That's incredible.
And the best part is it's generally painless and has a very, very high success rate.
That's really good to know. Now, what about freezing or cryopexy? When would they choose that over the laser treatment?
Yeah, so cryopexy is a great option when the tear is in a difficult spot that's hard to reach with a laser,
Oh,
or if the patient has other eye conditions that might make laser treatment less suitable.
so it's kind of like they have different tools for different situations.
Exactly.
But how does freezing actually fix a tear?
It's a similar concept to laser treatment.
Okay.
We're still aiming to create that seal,
Right.
but instead of using heat, we're using extreme cold.
Okay.
So the doctor will apply a very, very cold probe to the outer surface of the eye, right over where the tear is.
Directly on the eye.
Yes.
Wow.
And what this freezing cold does is it creates a scar around the tear, effectively sealing it up.
Okay.
And again, like laser treatment, it's typically a very quick outpatient procedure.
Got it. So both of those sound really effective.
Mm-hmm.
Are there ever cases where a retinal tear doesn't need immediate intervention?
You're right. Not all retinal tears need, to be fixed right away.
Okay.
If the tear is small, it's low risk, and you're not experiencing any vision problems.
Okay.
The doctor might recommend a more conservative approach, where they kind of just closely monitor the tear for any changes.
So a wait-and-see approach, but with very careful observation.
Exactly.
Okay.
And in some cases, the eye might even start to heal itself naturally, believe it or not.
Really?
It'll start to form a stabilizing scar around the tear on its own. The body is pretty amazing.
That is amazing.
Yeah.
But I imagine even in those cases, those regular checkups with the eye doctor are still really important.
Absolutely. Those follow-up appointments are key to make sure that that conservative approach is still the best option.
Gotcha. Makes sense.
Yeah. And, this might be a good time to shift gears a little bit, but I know you're probably wondering, who's most at risk for these tears?
Yeah, that's a great point. Are there certain things that make someone more likely to experience a retinal tear? So before the break, we were talking about those risk factors. What are some of the things that make someone more likely to get a retinal tear?
Well, like we were saying, age is a big one.
Okay.
As we get older, that vitreous gel, it's more likely to shrink and pull on the retina.
Makes sense, given what you said about PVD. What else?
Nearsightedness is another factor. So people who are nearsighted, they tend to have longer eyeballs.
Okay.
And this can stretch the retina, make it a little bit more delicate.
So the shape of the eye itself plays a role. Interesting.
It does. And like a lot of health conditions, family history can increase your risk. So if a close relative has had retinal tears or retinal detachment, you might be more likely to experience it too.
Yeah, genetics. How about like past eye injuries? Could that lead to this down the line?
Like absolutely. Significant trauma to the eye, like a sports injury or some kind of accident that can increase the risk even years later.
Wow.
And previous eye surgeries, particularly cataract surgery, can also make someone more susceptible.
So it seems like anything that puts extra stress on the eye.
That's a good way to put it.
Okay, good to know.
And there's one more factor I should mention. It's called lattice degeneration. And basically what that is when you have these thin areas in the retinal tissue and it weakens it. And it's more common in people who are very nearsighted.
So we've got age, nearsightedness, family history, eye injuries, previous surgery, and lattice degeneration. It's a lot to keep in mind. But even if someone doesn't have any of these risk factors, it's still possible to have a retinal tear, right?
Yeah, you're absolutely right. I mean, these are risk factors, not guarantees.
Right.
So while they might increase someone's chances, anyone can experience it.
Okay, so it's important for everyone to kind of be aware of these things. Speaking of which, are there steps people can take to prevent retinal tears? I mean, I know you can't prevent everything.
Right. You can't eliminate the risk entirely, but there are definitely things you can do to protect your vision.
Okay, good.
So, number one, if you're active in sports or any activities that could involve eye injuries, protective eyewear.
A must.
Non-negotiable. That's number one.
Safety goggles, all that.
Exactly. Another crucial step is getting regular comprehensive eye exams. And I don't just mean like a quick vision check. I'm talking about a dilated eye exam where they can really see the retina.
So early detection is key, just like a lot of other health issues.
You got it. Catching these things early can make a world of difference. And then finally, don't ignore those warning signs you talked about,
Yeah.
especially a sudden change in your vision, like a sudden increase in floaters.
Yeah,
Even if it turns out to be nothing serious, it's always better to be safe than sorry.
absolutely. When it comes to your vision, definitely get it checked out. As we're wrapping up here, what's the one thing you really want our listeners to take away from this deep dive on retinal tears?
I think the biggest takeaway is just, knowledge is power. Understanding the warning signs and seeking medical attention if you need it, that can truly be sight-saving. So schedule those eye exams, and if anything changes, if you notice anything with your vision, contact an eye doctor.
Well said. And for our listeners, we hope you found this deep dive into retinal tears informative. Remember, your vision is precious. Take care of your eyes. We'll catch you next time on our next deep dive. Until then, stay curious.